Autism, more accurately, autism spectrum disorder, it's not a single story. It's about experiences, abilities, challenges, and perspectives that people face every day in their everyday life. Today, we're more than aware of autism, but still, there's room for more depth. And we are at the moment where sincere advocacy and lived experiences are beginning to intersect in very, very powerful ways. Tonight, I'm extremely fortunate to be joined by a panel of experts who are going to be, who have diverse perspectives. You're going to hear clinical insight to personal journeys. So we're going to cover the whole spectrum. It's not about diagnoses, it's not about definitions, it's about everyday lives. It's about navigating the parents' fears. It's about the challenges of people who have autism. And it's about the experience of clinical educators on how they navigate the everyday world and how they can help us as a community to generate empathy towards autism. So, I would like to introduce my distinguished guests. I'm going to start off by introducing Dr. Suzzanna Javed. Suzzanna has been with me here before. As you may recall, she has her PhD from Columbia University. She's a college professor, a behavior consultant, educator, and advocate for individuals with disabilities. She conducts functional behavior assessments, evaluation for autisms, and as also is an independent broker for self-direction authorized by New York State Office for People with Developmental Disabilities. That's a lot of hats, Susanna. Welcome back. Then I
Yes, thank
have
you,
Dr.
Amna. Thank you so much
Of
for
course,
having
it's a
me.
pleasure to have you back. Dr. Lisa Changchein is the Director of Behavior Support at Family Residencies and Essential Enterprises Incorporation. She completed her medical training at Syracuse and went on to complete a residency at Stony Brook, where she developed a strong clinical foundation in patient-centered care. She brings a thoughtful, evidence-based approach to supporting individuals with diverse behavioral and mental health needs. So she combines deep commitment to improving quality of health with behavioral and mental health needs. Thank you, Dr. Chengchen, for joining us too. And now I have this pleasure to have you here. And now I have the star of the evening, Chris Hopkins. Hi, Chris.
Hi,
I'm really honored to have you with us today.
I'm honored to be here.
Oh, thank you. I'm glad. So he lives independently. He drives, which is a true reflection of his independence. And Chris, I'm going to let you take on from here. You tell us about your story, about your experiences.
I'm going to start off as a very young child, before they even knew there was autism. And they just thought that it was a learning disability. They had no idea that autism existed. Autism is in my case, works against me in so many ways because I don't look like I have anything. I don't look like I have anything wrong. I look like the normal kid on the street. I don't have Down syndrome. I don't have, I don't have anything that look like there's something wrong.
Like visibly something.
Yes, I get it. Yeah.
Something wrong. So that always worked against me. And they always, because of that, they were afraid of me in school. So they put me in classrooms that were lower functioning than me. But I always proved them wrong. In Warwick High School, they put me in the next level up, and I always get a passing grade. And, I'm a very audible person. So I just listened to what the teacher had to say, and I got an 85 on all my tests, which is, I think, pretty good.
That's commendable.
Yeah, 85%. I didn't even get 85%, so you're really good.
Yeah, I got 85. I wish that they had listened to me sooner, but that's the way it goes. So autism, like you said, has a very wide spectrum. There's a spectrum of children with autism that can't speak, and they just can't speak. They look like you and me. They understand you. I worked with children like that for a while at the Half Hour Hills pool, and two of them.
Yeah, he was a swimming instructor.
Yes.
Oh, wow.
For children with autism and intellectual disability.
Yes.
So he used his autism to help children and with autism and taught them how to swim.
And other disabilities as well.
Mhm.
So, my road has been very interesting. I spent all my life home with my mother, who unfortunately has passed away from pancreatic cancer
Oh, I'm sorry.
just recently. And it's been a challenge for me to live on my own, to get used to an apartment. Because I lived in the same house for 63 years.
Wow.
And it's home is home. What can I tell you?
Yeah.
And here I am on my own, and
With a cat.
with a cat, Dorothy. I don't know where Dorothy is. She might show up sooner or later.
She will?
Huh?
Yeah, we'd love to meet her.
She's a 20. She's a tortoise 20.
Mhm.
And there's probably sleeping on the bed. Snoring away. Anyway, and my life in school was never one that was easy, because I was never understood. It was always, the only school that I ever really went to was Leeway. I don't know if you ever heard of Leeway.
I'm not familiar with that, no.
I think it's for special
needs.
for special needs in Huntington. It was a private school, right?
Okay.
No, it was at the time it was in St. James.
Oh, it was at
And I
St.
was
James.
in Huntington.
Okay.
So I had quite a ride to school every morning. So I really enjoyed it there, but I aged out. I think I aged out. I went in when I was 9, 8 or 9, and then it's a 2 year school, 2 or 3 year school. So I aged out, and I never found another school that was as good. My parents, of course, but Phil Burchin was the director of the school at the time, and she was excellent. She was just very patient.
So, Chris, sorry to cut you off, but since we're talking about this, I just wanted to ask, do you still, I know, feel that there's still a dearth of such educational institutions where, kids with autism or on the spectrum um, get enough support, educational support, recreational support? Or do you think now we've kind of filling that gap?
Well, more so filling the gap. I still think we have some work. We have work to. We have a ways to go as far as understanding what autism is and understanding the differences in different people. Different people are different. Everyone's different.
Of course, yeah.
But as far as autism goes, I still feel like we have a ways to go as far as meeting their needs, because one thing, I'll make a joke. to some people it's tomato, and to some people it's tomato.
Tomato.
You
Yeah.
know, and you know, the kids. Some kids get the joke, and some people don't. So how do you fill that? How do you fill that? How do you fill that hole?
Mhm.
How do you fill that need? Well, you have to have people that are very caring and understanding, and a diverse group of people, um, from all different walks of life, to understand what what it is they need. It's just not a cookie cutter
Right.
kind of thing where you know
You learn a strategy
learn
and
the
you can
strategy.
apply a strategy on all.
Yeah,
Mhm.
So
yeah.
also, Chris, so out of school, in what area of life did you feel the least supported when you stepped into practical life?
Well, this is going to sound interesting, but I feel like the people that understand you, they they um they really do get it. Uh, like I don't know if you remember Kmart,
Mm-hmm.
the supermarket Kmart.
Yeah.
They taught me how to work the cash registers because no one ever took the time to teach me how to work the cash registers. And I was one of the best cash registers. I really got the idea, and it wasn't that hard, to do. It was really simple, and when I was at Stop and Shop, the same thing. I was a cashier, but the work gets mundane after a while.
Mhm. So you wanted somebody to have patience and you wanted people to, help you learn those strategies. And once you kind of learned them, you were very comfortable with them. But
Yes.
once you were comfortable, at one point it started becoming boring.
Right.
Okay.
Okay, and then you were ready for the next challenge, like all of us.
Yeah.
Right.
Okay. So tell us a little bit more about I know you just said that you worked as at a cash register. What else have you tried or dabbled with or tried your hands at?
Skiing.
Oh wow.
Um, I
That
was
takes some doing.
I was a skier once. Well,
And skater too.
very good roller skater.
Yeah, he could
Wow.
roller skate backwards, I've heard.
Yeah, very good. And I had a lot of
That
I
requires a
still.
lot of skill, I gotta tell you. I cannot stay on the skates for more than 30 seconds. I'm on my back.
Well, it takes some practice. Um, you know, practice makes perfect.
Absolutely.
You know, so I was a good swimmer.
Yeah.
I swam. My father taught me how to swim. We always had swimming pools, and there's one thing he taught me how to do with a pool around is learn how to swim.
Mhm.
You know, for my own safety. And my brother and I would have races with my father, and see if we could beat him. But it was a little difficult
I bet.
at first. But we got better and better. I miss my family.
I'm
My
sure.
father died of a heart attack about 13 years ago.
I'm sorry.
So
Yeah, it's hard to
it's,
lose the loved ones. Dr. Chengchen, just a question for you. What
Mhm.
is your role and how do you come into I know you went to a med school and did your residency and everything
In
and then
psychiatry.
in psychiatry, yes. And then what
Yes.
brought you and made you really interested in this and how have you been a part of this whole effort?
Well, I started at Free as what's known as a behavior intervention specialist, and I was working in the group homes, looking at what would happen is the staff would document behaviors, and we would look at that data, analyze, and look for patterns of behavior that were just frequent enough or disruptive enough that they were in some way preventing an individual from being able to live more independently or reach individual goals they had, such as living more independently or getting a job and making money. And I would take that, analyze that data, identify behaviors that they needed to what we term maladaptive behaviors, like I said, disruptive behaviors that were preventing an individual from living more independently and reaching their goals. And then I would devise strategies and what's known as a behavior support plan to help the staff to work with the individual to reduce those maladaptive behaviors and replace them with healthier adaptive behaviors, such as because of their diagnoses or their deficits. For example, some individuals have difficulty maybe expressing themselves verbally. And so when they're faced with a situation where they're struggling to express their feelings and they become, frustrated, it's sometimes easier for them to punch a wall than to continue to try to struggle and engage in a conversation that may be confusing or frightening to them. And so part of the work of the behavior intervention specialist is to try to identify strategies to help the individual first, one, be able to identify, I'm starting to get frustrated, maybe, and then offer them some type of strategy. Once they have that identification, like, I'm getting frustrated, now's the time to work on my breathing exercises so I don't end up punching a wall.
But the best thing about Lisa, and I'm sorry to interject, is that Lisa she's the director of behaviorally complex and forensic side of so they have intellectual disability, but they also have component of like some criminal background or some inability to be able to, identify sometimes those behaviors that get them into, criminal situations. So Lisa works with those, I would say, like challenging behaviors. So but yeah, so I wanted to point that out. I know Lisa kind of made it sound very simple, but Lisa is in that the director of like the forensic and clinically complex housing.
Yes, Suzzanna stated I worked as a behavior and suspension specialist for a little bit over 6 years, and then I was promoted because my supervisors were promoted. I ended up moving into her role as an assistant director of behavior support, where I oversaw the behavior support and clinical services at a cluster. And so then I supervise the behavior and intervention specialists and behavior support specialists at a cluster of currently I oversee the services at 8 group homes plus our crisis house. And as Dr. Javed stated, we work with the houses that are supporting what are known as clinically complex individuals. And these individuals tend to be higher functioning, but they also tend to engage in more high risk behaviors such as physical aggression, inappropriate sexual behavior. And quite a few of them do have some type of involvement with a history or a current involvement with the criminal legal system.
Oh, okay. And from what I gathered, when you were describing your scope of work, it seems like that the plans or the treatment plans or the action plans that you formulate are individualized, they're customized, they're not like Chris was referring to earlier, they're not cookie cutter. It's just like you analyze every single behavior and then come up with a plan to address that. So that is extremely hard work, and I'm sure it's very involved and it's an impressive effort, I must say.
Thank you very much. And yes, absolutely. About one of the hallmarks of our work involves what's known as person-centered care, where we, like you said, not one size does not fit all, and our plans absolutely cannot be cookie cutter because, for example, one of the strategies we may utilize to help an individual decrease a maladaptive behavior is a reward system where if they refrain from a particular maladaptive behavior, they may earn some type of reward. And what one individual might find motivating is not the same as what another individual may find motivating.
True. So I know this is very specialized, but if we were to extrapolate this to general community, what would you tell them? I know we're not going to be as specific in terms of our responses to everyone, but how would you tell us to react in different situations if we come across something similar?
Do you want to go, Lisa?
Either of
Like,
you,
go first, or-
since you
Okay,
guys are the
so
experts.
I would start with what Chris said, that how would we respond to people. So even when you work with an individual with disability, you have to understand where they are coming from, what is their function of behavior, because there are different things that they are trying to do. Sometimes they are having getting agitated because of a medical reason. They're having a headache, or they want something, like they are communicating that they want some tangible, like something concrete, like a juice or a Lego or something, or they could be asking for your attention. And sometimes, there is positive attention and then there is negative attention, and both of them are. So before it starts becoming negative, you should start reinforcing what can be positive. And there are sensory issues. And I think Chris can talk more about the sensory issues, because sometimes this is what I learned working with Chris, that we were driving together and Chris is like, this road is so loud. And I was like, it's not that loud. What do you mean by that? He's like, this is really, really loud. And I was like, oh, maybe do you want me to turn on some meditation music? And he was like, yes, turn on some meditation music. So we did. His favorite music is like this symphony hall channel. We turned that on, and he stopped. So there is sensory,
Yeah.
and then there is escape. Escape is when sometimes people, when they are not in control, things are difficult to kind of accomplish, they start trying to avoid it. So that is like what we call escape. And like, coming back to the whole thing, we have to cater what is that individual's need and how we can address that specific need. And with individuals with autism, OCD, and what's the third one? OCD, autism, and ADHD. All of them are very overlapping.
Okay.
And so when you are trying to work with them, sometimes people say, oh, this is very, you're on the spectrum. And sometimes they're like, oh, this is very OCD. But some of the symptoms are so overlapping that it's really difficult sometimes to separate them and then identify how we can support them. Chris, do you want to add a word or two?
Well, one thing working with Suzzanna, I've learned is, one of the getting used to a different person. I lived with my mother all my life, so I mean that was it, And then Suzzanna comes into my life and she goes, "Oh, look, I just got my nails done."
Oh.
And I said, so I threw a little joke in there. And she said, my mother was always getting her nails done, similarities.
Yeah.
That my mother.
He always tells me, Suzzanna, you're acting like my mother. She also used to tell me, look, Chris, I got my nails done.
So similarities to my mom, which helped me to identify,
Bond with her.
make life a little easier.
So I
Yeah.
think the Chris, it kind of helps him relate that social support. So
Yeah.
from coming from like not having his mom to somebody he can find similar, characteristics, and he finds that support. That I'm always like, what time did you take your medication?
No.
Did you take your medication, Chris? What time? What medications did you take? So like, and like trying to keep him
Yeah,
like yes. So did you take your blood pressure? Did you turn your things on? Like there are
Yeah.
different equipments that he needs to work on. So I always ask him what is the way he can remind. So we have worked on Alexa, like putting so much reminders on Alexa over and over again. So Lisa can add to what we are already talking about. So Lisa.
So just to build upon what they talked about, when I
Mhm.
when I teach in orientation, for example, I talk a little about how, like Susanna mentioned, very rarely, with very few exceptions, behaviors don't occur out of nowhere for no reason. There's usually
Yes.
some type of motivation, some type of function about it. And I'm going to steal a line from Dr. Javed's presentation that she recently presented at a conference that I attended that I love. She said it's important for us to be curious rather than judgmental, and really ask ourselves, we talk about shifting the question from what's wrong with you to what happened to you, because
I
oftentimes we
know.
talk about behavior being communication, and specifically the communication of some sort of unmet want or need.
Mhm.
So it's always important to look, okay, we talk about what was happening before the behavior, during the behavior, and after the behavior to try to identify potential triggers, what the motivation is, what is the individual trying to communicate, and then as a result of that, like it's always about reframing things, shifting the blame away from the individual and putting the onus on us to work together as a team to figure out how to meet this individual's needs and support them.
Yeah, Skinner said that the pigeon is always right. Fred Keller said that the student is always right. So I always take that thing that when you are the one who's working with somebody, you have to learn how to motivate them, how to encourage them, how to listen to them. And sometimes I go into these team meetings, and I've discussed this with Lisa so many times. I go to these team meetings, and there are Chris is very expressive. So that's really good for Chris. And he understands so much more better than a lot of the times these individuals that kind of fall through the cracks. So they might be able to talk, but they might not be able to understand or express themselves. And sometimes they are in the meeting and they're like, "Do you like staying at this place, right?" And they're like, "Yeah, yeah, yeah, you're right." And then
Yeah.
I'm like, are they really saying right? Do they really are comprehending? It's almost like you ask a 3-year-old, "Do you like mom or dad?" And they will say mom because it was the first choice that they had, or your
Yeah.
dad and mom, or dad because that was the last choice. So I feel like sometimes those individuals have difficulty advocating and making decisions for themselves. Like Chris, I'm really happy that Chris makes his own decisions without any help. Sometimes we encourage him to do things, but he makes his own choice. And that is like the Michael Jackson movie came, and I was like, "Oh, Chris, we should watch the Michael Jackson movie." He got motivated. Then he's like, "I don't think I want to watch it." Yes, so that's
That's
his
fine.
choice. Even when we are there, it should be his choice to say, "No, I don't want to watch it." So, I mean, we are planning to watch it again, but if he says no again, that's it.
Yeah. There's a lot to that Michael Jackson.
Yeah.
So, Chris, one last question for you. So, growing up over the period of years as a child, now as an adult, what barriers do you think people with autism or, like Susanna was talking about on this spectrum with OCD, ADHD, face when they're trying to be heard? And how we as community can help them with that.
Listen to them. Listen to listen to what it is that's going on in their life.
Mhm.
Just don't say yes into death and throw the baby out with the bathwater, so to speak. Well, it makes
I think that
sense.
that's a very effective message. Listen to them, pay attention to them.
Just listen to what's going on. Let's say they're sitting around the dinner table and they don't like the food. Well, you ask somebody, how do you like the food? Well, this is what's in front of me, so I guess I have to eat this food.
Mm-hmm.
You know, be sensitive to their needs.
Mhm. Mhm.
Be sensitive to what is going on. Oh, it's too warm in here. Well, turn on the AC then.
Mm-hmm.
You know, or one of the kids is being extremely annoying. Well, find out why he's being annoying. Maybe he's looking for attention.
Mm. True.
Maybe that's the main motive. Maybe he's looking for more attention for some reason.
Mhm.
Uh, all those things together make sense to me. That's why it's so diversified. That's why it's so like that. There's no two people are alike, and what you may not like, another person may really like, and the other way around. So yeah,
True. Thank you. All
you're
things.
welcome.
Dr. Javed and Dr. Changchein, you being the advocates and experts, anything that you'd like to add?
Go ahead, Lisa. First, you go ahead.
Well, I don't really feel like I have anything to add, so
I think what Chris said, definitely the communication should be very, you know, everybody's different. Everybody, the way they are trying to communicate, sometimes they are communicating with words, sometimes they are communicating with gestures, and sometimes they are communicating with no words because when they're overwhelmed, they're not using words, and that's their way of communication that they are not able to express their needs. So we definitely need to kind of help them where they are. We have to, when a little kid is trying to communicate, you go down on your knees to kind of look into their eyes to communicate with them, and that's what you need to do with all human beings, that you have to motivate them, to help them understand them, and see what they want. And that's like my biggest, I would say, pet peeve, that when people don't understand people and try to kind of manipulate them to do things what they think is the best for that person. And I want people to be able to make their decisions, and from their decisions, even if they are bad decisions, to learn so that they can make better decisions. Because once you learn from making a mistake, that's when you make a better choice. So, yeah.
And the most. Yeah. Thank you. Thank you all,
Thank
especially
you.
Chris. No, thank you
Thank
for it was lovely having you here, and thank you for being an advocate, an inspiration, a role model. I truly appreciate the fact that you were able to join tonight. And obviously, thank you, Suzzanna, Lisa.
Mhm.
And Suzzanna, I'm going to make your quote viral. So I'm going to leave you all with be curious, don't be judgmental. Thank you.
you.
Thank you so
Bye.
much.
thank you so much.